tech gonna take over my job?
Let's see if you're keeping yours by the end of this. Right. Today we have tech versus clinician. We have a physiotherapist here. I have tech right here. Today we're going to find out who comes out on top with some clinical questions regarding some case studies and follow-up questions to do with the treatment side of things. You think you're ready?
It's that scary question everyone's asking. Is tech gonna take over my job?
Let's see if you're keeping yours by the end of this.
Let's do this.
You ready to get started?
Come on then.
Right. The first case study is a 38-year-old man who is seeking treatment at an outpatient clinic for right ankle and shin pain. It's an insidious onset and it's been happening for 2 weeks and it's now unrelenting, even at night. The pain has spread from his ankle into the shin. He's a regular jogger and has not changed his training regime at all. He believes his pain is related to running. He has not been seen by his family physician and about this condition because the physician's out of country for 2 weeks. He's on holiday, enjoying himself. He does not have a history of leg injuries and is in excellent health except for a recent tooth infection. So that's your case study. Any questions regarding that?
No.
Yeah, you got a good picture?
Yeah.
Brilliant. Which of the following reports from the client's history may lead to the physiotherapist suspecting a diagnosis of osteomyelitis?
Oof.
Yep. A,
Okay.
pain at night. B, recent history of infection. C, lack of mechanism of injury. Or D, pain, pattern and location of painful area.
I feel like the question already gave it away because why would they add in the toothache in the question? So I'm going to go with the recent infection.
Brilliant. So that is, in fact, the correct answer.
There we go.
I've just asked ChatGPT exactly the same thing. The answer is B, recent history of infection. Very good. So that's 1-1.
I felt like that was a cheap one. It was in the question.
We're starting off pretty light. Number 2. So related to the same case study.
Okay.
After completing the assessment, the physiotherapist suspects that the client may have osteomyelitis. Which of the following courses of action would be the most appropriate for the physio to take? A, commence treatment and closely monitor his symptoms. B, recommend immediate consultation with a physician. C, suggest that the client contact his physician in 2 weeks. Or D, contact the client's physician in 2 weeks to review the client's condition.
Now I would immediately go and see the physician. So is that B?
Yes. So
Yeah.
you would recommend
Yeah.
immediate consultation with the physician.
Yeah, I would.
Perfect. So that is the answer for it. The mark scheme allows you to have the same answer.
Hey.
Now I'll ask ChatGPT the same question to see what chat says. So chat's taking his time thinking this time. Very good. So the chat's come back and said the exact same thing. The answer is B. Recommend immediate consultation with the physician. Very good.
So it's 2 for 2, huh?
2 for 2.
Let's go.
Part
Still
3.
got my job so far.
Yep. Part 3 of the same case study. After completing the assessment, the physiotherapist decides to treat the client's pain symptoms as part of the treatment plan.
Okay.
Which of the following modalities would be the most appropriate to use? A, ice. B, superficial heat. C, shortwave diathermy. Or B, thermal dose of ultrasound.
Definitely not the last two. Not the heat. I would say ice. Osteomyelitis, definitely ice.
Perfect. That's what the mark scheme allows you to have. So
Hey,
you're
3 for 3.
You're 3 for 3. Let's see what chat says. So chat is first explaining everything, but it's come back with the same conclusion. Actually, ice is the best treatment for this.
Yeah, it makes sense. It's
Brilliant.
information.
You're 3 for 3 at the moment, so you and chat are neck and neck.
Go on then. I need something a little bit more tough, huh?
You think so?
No, I'll go
Okay, well, this is the last question coming up for the same case study.
Okay.
The physiotherapist finds that the client is lacking active and passive dorsiflexion range of movements in his ankle. How should the physiotherapist approach joint mobilizations for this client? A, posterior manipulation of the talus on the tibia. B, grade 4 anterior glide mobilizations of the talus on the tibia. C, grade 4 posterior glides mobilizations of the talus on the tibia. Or D, joint mobilizations as contraindicated.
Joint mobilization is contraindicated, right?
So,
In my opinion, I would say it's contraindicated.
joint mobilizations are contraindicated, you think? Yeah? So, 21. Let's see what this says. Perfect. It is contraindications, and that's what ChatGPT has come back with as well.
Yeah, you wouldn't want to be mobilizing an infection. That just does not make any sense in my head.
No, it doesn't add up, does it really?
No acute scenario would require a mobilization.
Very good. And I know that from personal experience.
Yeah, do
Yeah.
you? Huh?
Yeah. Amazing. Good. So that was the first case study. You were 4 for 4. Chat was 4 for 4. You ready for the next case study?
Go for it.
Brilliant. A 60-year-old man with post-polio syndrome is experiencing a deterioration of his physical status. He is attending an outpatient physiotherapy at a rehab center.
Mm-hmm.
During the assessment, the physio notes weakness of the erector spinae muscle group.
Mm-hmm.
Which of the following postures is a physiotherapist likely to observe?
Mm-hmm.
Decreased thoracic kyphosis, increased lumbar lordosis, decreased lumbar lordosis, or thoracic scoliosis?
Decreased lumbar lordosis.
Very good. So you have said that. Perfect. Let's see what ChatGPT comes back with. The correct answer in the scenario is C, decreased lumbar lordosis. That's what Chat has said. Perfect. And the mark scheme says the exact same thing.
So we're 5 for 5.
5 for 5. So the next question for the same case study. The client has greater paralysis on his left lower extremity, which may be contributing to the right knee and ankle pain due to overuse. Which of the following supportive devices should the physiotherapist recommend for the left lower extremity?
Okay.
A, neoprene knee sleeve.
No.
B, ankle splint.
Maybe.
C, hinged knee brace. Or D, knee ankle foot orthosis.
That one. Knee ankle foot orthosis.
Perfect. The mark scheme says D as well.
Perfect.
Let's have a look what chat says. Yep, chat's come back. First sentence, the correct answer is D. I've lost track of how many questions I've asked actually, but you are...
I think I'm 6 for 6.
Yep, and so is chat. You are neck and neck. Amazing. Next one. The client has used crutches for 8 years. He states that his walking has slowed and longer distances are more fatiguing. Which of the following aids should the physio recommend for longer distances in the community?
Mm-hmm.
A, a 4-wheeled walker. B, a 2-wheeled walker. C, a manual wheelchair. And D, a powered scooter.
I'm going with a 4-wheeled walker. You want to maintain functionality, in my opinion. So I would go with a 4-wheeled walker. At least then he has some option to, take a seat if he gets fatigued, rest a little, get up, and continue walking.
Okay, yeah. So that's your answer and justification. The mark scheme actually says powered scooter. Completely.
Why?
Yeah, that's fair. And when asked, chat comes back and says the same thing, a powered scooter.
But you're just making people lazier. Well, I guess if it fatigues him, because what was the initial condition?
The initial condition was post-polio syndrome.
Oh, okay, yeah. In that case, because it's a progressive neuro condition, you probably, or it's not really progressive in a sense.
Yeah.
You probably, yeah, okay, makes sense to get a power scooter in that sense.
Yes. So in that case study, actually, you will be making people work very hard.
Yeah.
Yeah.
So what does that make me 6 for 7 then?
Yes, you're 6 for 7, and chat is 7 for 7. Very good. Right.
It's got my job so far.
It's got your job so far. Okay. Now the next case study. A 50-year-old man comes to private physio clinic for an aerobic exercise program. He has a 10-year history of insulin-dependent diabetes.
Okay.
Yeah. First question. Which signs and symptoms of hypoglycemia should the physio anticipate the client may demonstrate while participating in aerobic exercise program?
Okay.
A, manic mood, increased energy level.
Okay.
B, increased temperature, flushed face.
Okay.
C, weakness and excessive sweating.
Mm-hmm.
And D, nystagmus, ringing in the ears.
I would say weakness and excessive sweating. That makes sense.
Yeah, actually, that's what the mark scheme says.
Perfect.
And let's have a look. Let's see what chat says. Yep, chat comes back and says the exact same
Of course.
answer.
It's just perfect, isn't it? It's got a database of perfection.
It does.
So much knowledge.
So much knowledge. Right. In designing the aerobic cycling program for the client, which of the following exercise parameters should the physio recommend? A, 4 to 7 days a week for 20 to 60 minutes. It doesn't state what exertion. Okay. B, daily at 20 to 40% of maximum heart rate. C, daily at 80 to 90% of maximum heart rate. Or D, 3 to 5 days a week for 60 to 90 minutes.
What was that first option again?
4 to 7 days a week for 20 to 60 minutes.
Yeah, I'm going with that one.
Yep, so the mark scheme says A, and chat comes back and says A as well.
Yeah, it just makes sense. Yeah.
Good. And question...
Also follows like the government guidelines, basically. So yeah.
So national guidelines.
Yeah.
Perfect. Good. And the next question: which of the following components of client's treatment can the physio assign to the physiotherapy assistant?
Mm-hmm.
A. Progression of the exercise program.
Mm-hmm.
B. Examination of the feet. C. Assessment of the fitness level.
Mm-hmm.
And D. Monitoring of the exercise program.
I'd just say monitoring of the exercise program. The rest is all a physio job.
Yep. Perfect. That's what the mark scheme says.
I don't see chat doing any of that.
You know your remits. What, monitoring the exercise program?
No, doing any of the other stuff.
Oh, progressing the exercise program, examining the
Yeah,
feet,
that's what you need a
assessment
physio
of the
for.
assessment level. Yep, you're absolutely right. And ChatGPT has come back and said the same thing.
Yeah.
It's outlined the remits of what a assistant can do.
But I bet you anything, you know, you give it another piece of tech, you know, we'll go one more generation forward. We're going to have somebody or something where tech is just going to be observing our human population in that sense and be able to give you all those answers and figure out what's wrong with us.
Yeah,
you know,
using
assess the body's alignment, all of that. You know, we already have technology like that anyways.
Yeah.
Just input devices and give them the objective measurements, and chat will give you all the answers of what you need to be doing. I'll bet you that's what we're going to be going in.
Yeah, well, but so far, I would say actually you've answered majority of the questions correctly as well on the fly without as much of a database as possible. So actually your knowledge is pretty on point.
Yeah.
Very good.
Thank you.
Amazing. So that's the end of that segment. Yeah.
One thing is we'll never get rid of that human touch, will we?
No, absolutely not, because dealing with a human being, it's more personable and there are things you can notice. AI and technology is only as good as what you are able to tell it and how much detail you are able to go into.
Yeah, 100%. Well, next episode we're gonna put him up against the test, hand therapist versus AI, and then hopefully in the coming series we'll get some doctors and some surgeons and we'll put them to the test. Really answer those scary questions. Will tech really take over the healthcare industry?
Brilliant.
Let's do this.